So, how do pensions affect your Social Security benefits? We're going to talk about that today. A lot of people get in trouble because their pensions affect their Social Security benefits or their Medicare or their spouse's benefits. So, we're going to talk about all that today. Make sure y'all don't get some strange letters from Social Security saying you owe a whole bunch of money. All right. If you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country. And in my semi retirement here, I'm helping all people make sure they're getting everything and they're entitled to from Social Security, Medicare, retirement, spouse benefits, survivor benefits. This is also a live Q&A. I'm going to spend about 10 or 15 minutes on the pensions and Social Security. And then for the rest of the hour, I will answer any and all of your questions about all things Social Security, Medicare, Medicaid, all the rest of it. So make sure you type your question down into chat. And if you're here watching it later, out when it's not live, make sure you subscribe. And that way you have questions, you or your family have questions in the future. You can find us again. Okay. So pensions. Generally, pensions do not affect Social Security. I say generally, regular viewers of my channel know there's 20,000 pages of Social Security policy, and there's exceptions, the exceptions, the exceptions. And we'll talk about how they, again, Medicare, disability, non-covered pensions. That's one of the big ones. All right. So when Social Security was originally enacted back in 1935, was supposed to be three legs of a school of the stool. You're supposed to have Social Security, and you have your private pension from your company. You know, you work there for 30, 40 years, get a pension and a gold watch, and then you have your own savings. Unfortunately, with people's pay and pensions pretty much going the way of the dinosaur, it's pretty much just one-legged. And if we don't do something about Social Security soon, it's going to be pretty much a one-legged pogo stick, it seems like. But pensions, general pensions don't affect regular Social Security. So retirement benefits, spouse benefits, again, there are exceptions. One of the questions I get all the time is, okay, the issue is the annual earnings limit. If you retire early, below your full retirement age, you're limited to the amount of money you can make. And people always ask, okay, what does that include? Does it include my pension? No. Does it include the Social Security check I receive? No. Does it include like a 401k or IRA distribution I take out? No, that does not. When you're in your early retirement, we're talking about wages, W-2 wages, or we're talking about net income from self-employment. So those are the things that count against that annual earnings limit. Again, when they hold back $1 for every $2 you go over, or $1 for every $3 you go over. All right, let's talk about the exceptions and the different categories of when that will affect it. Pensions and Medicare. So quite a few years ago, they passed an IRMA, the Income Related Monthly Adjustment Amount. It's basically a higher premium on Part B and Part D as well. A lot of people forget about the Part D, the drug plan, in terms of the higher premium on that. It's not very much compared to the Part B. You could be paying, most people pay about $174. Next year, we don't know, 185 or something, but people with high income, they could pay an extra 100, 200, 300, $400 above and beyond that. And they calculate it based on your earnings from 2 years prior. And in those type of situations, pensions might trigger that higher premium. So work 2 years ago, and you're saying, why 2 years ago? Well, they don't know what you made until the close of the year, and they project your premium forward. So that's why it's a 2-year thing. It's actually logical once you calculate it out. So they look at 2 years ago, and they look at what you earned in terms of W-2 or net income from business, any type of income, your sale of your house, that also capital gains and sales of your house, that also counts against your IRMA. This year, it's $103,000 for a single, $206,000 if you're married. Anything over that is going to trigger that extra premium. And again, that also includes pensions as well, any type of pensions you have coming in. So that's going to cost you an extra higher premium. What about disability? In terms of SSDI, Social Security Disability Insurance, the regular disability insurance that you paid FICA for all those decades, it doesn't affect that unless it's a workers' comp, but that's not technically a pension, but I just want to throw that out there. Workers' comp, public disability benefits, if you're receiving that from a governmental agency, then that will affect your disability benefits. SSI, your pensions 100% will affect your SSIs. SSI is supplemental security income, a welfare-based program. So because it's a welfare-based program, any money you have coming in, doesn't matter where it comes from, including pensions, that will affect the amount you receive from SSI or whether you even qualified for SSI. What about our old friend IRS taxes? All right. So well, 50% of people don't pay IRS taxes. So we're not talking about Social Security, the annual earnings limit, $1 for every $2. We're not talking about that. We're talking your good friends at the IRS. So about 50% of people do not pay taxes on their federal taxes on their Social Security benefits because that's all they have coming in. So if that's pretty much all you have coming in, you're probably not paying taxes on that. People that have other sources of income, either they work or they're getting pensions or taking distributions or whatever the case may be, have other income, then the IRS can tax up to 85% of your Social Security benefits, not an 85%, rate, but 85% of your Social Security benefits is open to taxation. So your pension just might affect that, but that's between you and the IRS. One of the big exceptions that you see a lot of overpayments and a lot of people are not happy about is called non-covered pensions. Those 100% affect your Social Security benefit. If there is not an exception to that, and the exception is that if a non-covered pension, let me back up a little bit. Non-covered pension is a government entity, used to be the federal government, but the federal government started paying FICA taxes in the 1980s. But city, state, local county governments like Los Angeles, Chicago, Texas teachers, they're usually teachers, firefighters, government workers, police. There's about 5% of the workforce out there that work for one of these governmental organizations, and that organization does not pay into Social Security. They pay FICA, they pay the Medicare part of FICA, but they do not pay the Social Security part of FICA. And so they don't pay that. And if you've got a teacher in Texas that worked as a teacher for 30 years and gets a pension from the Texas pension fund, and they also worked in the summers doing something and they're eligible for Social Security benefits, then that non-covered pension they get from Texas will recalculate. It's called a windfall elimination provision, because basically lower income wage earners get an extra benefit. It's kind of a welfare type benefit, and teachers and firefighters get that extra welfare benefit. Wasn't intended for them. So that's the windfall elimination provision, a provision to eliminate the windfall. And there's also a government pension offset. If you're receiving spouse benefits, surviving divorced, regular spouse benefits, your non-covered pension will affect how much you receive from your spouse. And I've talked about those. They're kind of complicated, and there's exceptions. If you have 30 years of substantial gainful work, there's an exception to that. So, all right. So I did that fairly quickly in 10 minutes because we want to be able to get into some of your questions out there. And I've had a bunch of questions recently that I want to get to. Let's go ahead and put everything up here. All right, let's see. Christine, I have a question. We are going to joining Medicare for the first time and Social Security. My husband is 67 and I'm 71. My question is concerning Medicare. So if you're 67 and your husband is 71, so sounds like that might have done one of several different variables. When you're about to turn 65, you need to think about whether you're going to sign up for Medicare. If you have health insurance from current work, yours or your spouse's, and that employer has 20 or more employees, then you don't have to do anything if you don't want to. You don't have to sign up for Part A. You don't have to sign up for Part B. You don't have to sign up for money if you don't want to, if you're currently working. So, or some people go ahead and sign up for Part A because it's zero premium per month. And it might cover, help cover your hospital stay because Part A is hospital. That's what some people do. You actually have to contact Social Security and file for that. If you're already receiving Social Security benefits money, if you say, for instance, you sign up at 63 years old, about 100 days before you turn 65, Medicare will automatically sign you up for Part A and Part B. If you have health insurance at that time, you just refuse it, return the card, basically, and yeah, it's all good. And then in this case, it looks like Christine and her husband didn't sign up for Part A or Part B or either of them, which is fine, perfect, because you hopefully had health insurance from work, and now you're going to lose the health insurance. So about a couple of 3 months, bef- before you know that you're going to lose that health insurance, then you need to figure out, when you're going to lose it, and you want your Part A and Part B to essentially start the same month or the day after you lose your health insurance. So if you lose your health insurance at the end of November, then you want your Medicare to start the next day. You know what happens when you don't have health insurance for a day. That's when you actually get sick or accident or something. And then you also have to figure out how you're going to cover all the gaps because original Medicare Part A, Part B is awesome. Medicare covers Part A covers the hospital, Part B covers the doctors, but there's a lot of gaps there. The big one is the Part B coinsurance. So if you get $100,000 Band-Aid, you have to pay $20,000 of that because there's a 20% coinsurance. So people get either a Medicare supplement plan or a Medicare Advantage plan, and there are benefits and negatives to both of those. And if you reach out to my partners there at Chapter Medicare, they can go through, check and see exactly what's available in your area, ask you a bunch of questions, answer your questions, and determine what's best for you, and then get you all set up. And that's 100% free. Another thing that you also have to do because you didn't sign up, it sounds like you didn't sign up for Part B, is you need a couple of forms. It's the government. You always need forms, right? It's a 40B and a 564. You just type that in Google and you can download the PDF. And 40B, 564. And one of those you take to your employer and they fill it out and it says, yes, this person had health insurance since they turned 65. Don't penalize them. So, and then you get that all set up with Social Security and they take care of you. All right, let's see. Leanna, I have a part-time job teaching fitness classes. All right, awesome. For my city that has a non-covered pension, but it's very small. I assume the impact of my Social Security will be negligible. I can't pronounce words. Negligible. A lot of income on my regular job. I need more coffee. From my regular job. So yeah, if you again, the 30 years of substantial earnings, and then there's a chart on the SSA.gov website. It tells you what the substantial earnings were for every year, going back, 80s and 70s and stuff. But yeah, if it's just a small one, it's probably not going to have a big impact, particularly if you've got those 30 years of covered employment. Then it will have zero. If you have 29 years of covered employment, it has less, 28. So yes. All right. So because you may have a pension that gives you money towards your retirement, IRS wants to tax you. To me, that's not fair. They want to take everything where, yeah, well, that's, yeah. I've been trying to cancel my subscription to the IRS for decades, but I'm turning 65 in July. I'm getting a lot of insurance advertising. Yeah. That's, I've been on disability for 20 years. I thought retirement age has changed to 67. I want straight Medicare with Social Security kicks in. Okay, yes. Number one, yeah. John Oliver in Last Week Tonight did a great expose on data brokers. So every time you push a button and you Google search this or that, they kind of triangulate your birth date and how old you are, and then they target it. And in terms of 65, they sell that data to every health insurance company in the country, and they all want to take you to the 65-year-old prom. It's like you're back in high school, the homecoming queen. You are super popular. Everybody wants to take you to the 65-year-old Medicare dance. Um, but in your case, sounds like you've been receiving Medicare for a long, long time. But yes, you are turning 65 in July. So guess what? It sounds as though, like most people out there, if you get Medicare based on disability, in most states, you can't get a Medicare supplement plan. It's a state's regulation. States should definitely step up and allow you to get it, force the companies to give it to you, but they haven't yet. So all you were able to get is a Medicare Advantage plan. But now you're going to be turning 65. You can get it based on you're turning 65. So you can get any Medicare supplement plan you want. No underwriting, no issues with pre-existing conditions. You don't have to tell them anything about your health. And get a Medicare supplement, an N, a G, whatever the case may be, and they can't deny you. And again, no health underwriting. So reach out to my partners at Medicare, Chapter Medicare, and they will see what's available. And remember, when you get a Medicare supplement, it only comes with a Medicare supplement. You also have to get a standalone Part D plan. So, yes, you are forced to get Medicare at 65. Again, not necessarily. If you have health insurance from work, current work, yours, your spouse's, and all the rest of it, you don't have to get it. What if SSA has my birth year incorrect, making me 1 year older? Then you need to correct it. So it's basically on your Social Security card. Yes, I know it's not on your Social Security, but internally, it's called the numident, number identifier. And then internally on your Social Security card, you have, your name, your maiden name, your prior names. You have your parents' name, your mother's maiden name, your date of birth, your city and state where you're born. Is all that information on there. So it sounds as though your particular Social Security card has an incorrect date of birth. So you need to go in there and correct it. You have to provide an original birth certificate. Usually, how that people find out is their IRS taxes get kicked back. So when you file your taxes, put your Social Security number down there and the date of birth. If the computer system doesn't recognize the Social Security number with that date of birth, then they kick it back, and that's maybe how you find out about it. But you just get your original birth certificate, take it down there with your ID, and yep, they'll fix it. Easy, 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 easy. Done. I've done a million of those. I retired from a New York City job, pension check total $173. Yeah, so it sounds as though we're talking about New York City. Again, if you paid into Social Security, FICA Social Security, then that doesn't count as one of those non-covered pensions. May I ask your opinion on Advantage plan with give back? It's really, really good for some people. So an Advantage plan. So some people, they don't want to pay the extra money. They can't qualify for Medicaid, whatever the case may be, and they're healthy. And if that's the case, then yeah, I kind of like the Medicare Advantage with the give back, particularly for vets that predominantly use the VA medical system. If you predominantly use the VA medical system and you want to go ahead, keep Part B, which I recommend because you never know what's going to happen in the future. But you don't want to pay the Part B premium, you get a Part B give back and you get your cake and eat it too. But you have to be wary that these health insurance companies, I hate to break the news to you, these Medicare Advantage companies, they're in it for a profit. Shocking, right? So if they're just going to pay for Part B, $50, $100, 107, all of it, then, they're going to take that money out from somewhere. So on a regular plan, maybe you pay, if you go to a hospital, you pay $100 a night or $35 for a specialist or $90 for this. But on a Part B give back, they double or triple those prices because, they want to get that money back that they paid you. But if you're going to be, if you're young, 65, 66, 67, still super young, healthy, and it doesn't look like you're going to have any issues next year, and hopefully you don't, then yeah, that's awesome. Go ahead and get it, save yourself the several $1,000s next year and, take a vacation. And then the following year, if you're still super healthy, let it ride, or find a, better plan that gives you some more on the Part B give back. Or if it looks like the following year, oh, okay, I'm not feeling too good. Maybe I should go get this, and I might have to do this. And then you switch to a plan that covers you more, that but doesn't give you extra money. So, Barry, when the $1 for every $2 earned is held back, it will be figured back in later. What amount do you receive? Is it dollar for dollar, or is it figured back in the bin points or something like that? Oh, good question. So basically, yes, if you take your benefits 30 months earlier than your full retirement age, then your benefits are reduced by 30 months. But if you work and make more money, and Social Security holds back $1 for every $2 and everything, and they suspend your benefits, let's say at your full retirement age, you're being reduced by 30 months. And then the Social Security Administration looks at your record and say, wait a second, we're reducing this person by 30 months, but they only took 10 months worth of benefits and they were suspended. They didn't receive 20 checks. So what they do is they don't give you those 20 checks. They unreduce your benefits. So from then on, you're only reduced 10 months. So it's like you took your benefits 10 months early rather than 30 months early. So it's just recalculated like that. So it's called ARF, the adjusted reduction factor. And what if I don't stop the fitness job? No, okay, yeah. I think that was, yeah, I think they were talking about a non-covered pension there. Let me see. Darla, my question is, will both my SSDI and my survivor benefit, I get them separately, will both of them get the COLA? Yes, everything gets COLA. And as soon as the January comes around, the computer, the Social Security computer system is, I'm sure it's already been programmed to calculate it on all checks, all 70 million checks, effective January. It's already been put in there. They're just sitting there waiting. So as soon as, Department of Labor statistics come out with, I'm having issues with my, anyway. Yeah, it's the exciting 2.5%. Yeah. If you still have to work and the company you work for doesn't have health insurance, you're screwed. So you have to get Medicare and pay for $174. That is true. Yes. Yeah. Yes, even if you have health insurance from work, and even if your company has 20 or more employees, sometimes that company makes you sign up for Part A and Part B because they want to save money and move costs over to the federal government. So that's between you and the company. Social Security is not going to penalize you, but your company might. So you have to check with your company on that. Or your company health insurance just sucks. It's just terrible. Has a super high deductible and doesn't cover anything. So sometimes people have health insurance, but it's not as good as Medicare and a Medicare supplement. So they just get a Medicare and Medicare supplement. So working until 67, there's no penalties. In terms of penalties, yeah, I'm not sure about once you hit your full retirement age, nothing is withheld back in terms of $1 for every $2. So yeah, if that's what you're talking about, that is correct. I heard someone say that I can only use my Medicare Advantage sponsored by our group health plan in New York State where I live and I work now. Is it true only emergency cases I can use in other states? So it sounds as though you have yeah, this is, I don't like this. There's a lot of companies that you work for 30, 40, 50 years, and they say, okay, you're retired, here's the gold watch, here's your pension, and we're going to pay for your health care forever. And a lot of these private companies, rather than giving you like the same type of health care you had when you're working, they switch to a Medicare Advantage plan because it saves them a bunch of money and the CEO needs a new yacht. So and then you have, the networks, the declining networks, and prior authorizations and delays and denials and all the rest of it. So yeah, but some of those plans, they make up for it by paying for this, that, or the other. Some companies get a better Medicare Advantage plan than what's available in the open market. And so sometimes they're good, but maybe they're good for the first year or 2 years, and then they're no longer good anymore because the CEO needs a bigger yacht, so yeah. So I would, if, yeah, in terms of HMOs and PPOs, there's limitations to those. That's why I always, if it's in your budget, if you're able to afford it, then 100% a Medicare supplement plan, a plan F, G, N, and that way you can go to any doctor, hospital, clinic in the country. As long as they take Medicare, you're good. As I always say, if you have a Medicare supplement, your network is America. So, but I would check to see if your plan that you currently have is still the best plan. So I would maybe call chapter there or someone else. If you've got a, old high school buddy that also does, Medicare insurance, reach out to them. But if not, reach out to chapter there. Forest for the trees. I like that title. What if Social Security is telling me I made $0 during a certain year, yet the IRS is telling me I owe taxes that same year? Yeah, that could happen. You were self-employed or something like that. Or you owe taxes that year, you didn't pay them, so therefore you didn't report, or yeah, that could happen. So Social Security gets that year once the IRS tells them. So you file your taxes for that particular year, you send them to the IRS. The IRS tells Social Security your wages, how much you paid into FICA based on those particular wages or net income. So yes, that is possible. So I would definitely get that figured out. So you need to figure out with the IRS, and then if you resolve that year and you pay those FICA taxes and all that other stuff, then you take those down to the Social Security Administration and they'll correct your earnings record. That way you make sure you and your family get everything you're entitled to from your work record. I posted a question to you a couple days ago, but I don't see it. I had to go to work, so okay, all right. Can a widow who has been on Social Security since 1963, I'm sorry, since 63, can she now at 77 collect her own Social Security as well as her husband's or part of it? If so, you're about 7 years late. What this is internally in Social Security, we used to call this, well, they still call it, but I'm not an employee anymore, a WIB rib. So if you are receiving surviving spouse, widow's benefits, it's the same thing, and you don't touch yours because you're letting yours increase based on delayed retirement and getting those delayed retirement credits and all that kind of good stuff, which is good on you for doing that. Great strategy. But the problem is once you turn 70, it stops increasing. So if your benefit amount on your own record is more, the local Social Security office should have sent you a letter 7 years ago and said, hey, there's more money on your record. Come on down and file a claim. And if you didn't, and if there's more money and you didn't, then you've lost 7 years of extra money. So I would reach out to Social Security immediately, call them up right now and give them your information, and they'll look to see if there's any more money on your record. If there is, then file, and then also ask them for retroactivity as much as you can get, at the very least 6 months of back pay for those that missing money. I'm waiting to hear how much of X FERS pension I will get. Will this count against my Social Security when I collect in April? Nope, not at all. FERS does not. The old CSRS, the old federal system that, in my office, we had about 100 employees. And when I retired, none of them were under the old system that didn't pay into Social Security. Everybody was the new system, FERS, which you are, and you all pay into Social Security. That so has zero effect on your Social Security. You're 100% good. When they say my ticket to work ended, what does that mean? That means your ticket to work. That means you reached out to me and they helped you and they did everything they could and they've fulfilled their obligations and yeah. So it's a ticket to work or trial work period. Are you sure it wasn't the trial work period, that 9-month trial work period with being on SSDI? That might be it. Medicare should not force people to get it until they are retired. The costs are ridiculous. Yeah, they don't force you to get it. Yeah, if you have health insurance from work, then yeah, they don't force you to get it. So it's not mandatory if you have health insurance from current work. So that's pretty much it. Chapter Medicare helped me out. I chose Advantage with the give back, only $82 give back in my area, but hey, I'll take it. So that's over, what, 800, about $1,000 a year. So I like it, but I will take it. Also got dental, vision, and Part D drug plan. So I'm set for next year. Awesome. Good deal. Glad they took care of you. Yeah, I interviewed tons of organizations and agencies throughout the country, and they knocked it out of the park and everything. Their professionalism and their after service customer service, and yeah, so yeah, perfect. If I understand correctly, can I leave my Advantage plan once I reach my retirement age? You can always leave your Advantage plan and switch to another Advantage plan. Um, but Zasmin, are you the one that had disability? If you have disability, not at your retirement age, because your retirement age is, probably 66 or 67 or something, but 65, if you're the one that had disability and you were only able to get a Medicare Advantage plan because you were under 65, yes, once you hit 65, you can get out of that Advantage plan and get a Medicare supplement plan. Yes, 100%. In terms of switching to Medicare Advantage plan, now is the time to do it. Please, 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 everybody reach out to everybody you know. There are close to 2 million people that their Medicare plans, their Medicare Advantage, and their Part D plans are being canceled. This is the most tumultuous Medicare season ever. It's October 15th to December 7th. So many 2025 plans are no longer going to be there. So there's going to be hundreds of thousands of people that go into the doctor January, and the doctor is going to say, okay, here's your bill. And they're like, wait, I've got Medicare. No, that was canceled. That canceled, December 31st at midnight. And people didn't open the letter and realize that they're canceled, or their plan is downgraded to such an extent that you would want to cancel yourself. So please reach out to the person that signed you up, or someone, but reach out to Chapter Medicare, and they can check. They work the entire country, and they can check to see if your plan's been canceled or how much it's been downgraded, and see if there's anything else available out there for you. Again, 100% free. Tell them I said hi. Let's see. I am 71. My husband is 67. Starting the process now. I want to know what you think about Mark Cuban's online pharmacy as an option instead of Plan D. Um, no, I disagree. Don't like it at all. I like Mark Cuban's direct online pharmacy 100%. Yes, Mark, if you're watching, yes, old Texas guy myself here. So, but yes, instead of, because remember, all right. It looks as though we lost everybody there for a little bit. Okay, hope the satellite went down, or yeah, funny October surprise. Okay, all right. Mark Cuban's online pharmacy. I like it. Direct pharmacy. I like it. Some of the stuff in there is really, really cheap. So, but the last part of your question, instead of Part D, no, because if you have to sign up for Part D, because you have to sign up for Part B, you have to sign up for Part D, B and D both if you don't have health insurance from work and all that kind of stuff. So if it's your time to sign up, then you have to sign up for Part D. If you're going to use that online pharmacy and stuff like that, that's fine. But you don't want to be penalized for not signing up for Part D, because that's 1% every month you did not sign up for Part D. And remember, if you don't take that many medications, it's usually not a big deal. But if you take something expensive, here's the issue: is once you have a Part D, whether it's a standalone Part D or it's a Medicare Advantage Part D in there, there are deductibles and coinsurance that you have to pay. And then once you pay those within the system, then next year, once you hit $2,000, you don't have to pay anymore. But if you're buying all your stuff outside of that system, that doesn't count for your deductibles and coinsurance and stuff like that. But Christine, yeah, if you're, I would sign up for Part D. I would just get the cheapest Part D you possibly can, and then get your stuff off there. But remember, if you're buying a bunch of expensive stuff, all the stuff you buy from Mark is not going to count towards your deductibles and all the rest of it. So just keep an eye on that. And again, remember, you change your Part D every year. So you can, okay, I'll get the cheap one this year and I'm not going to have anything expensive. And next year, October 15th to December 7th, you can switch it. And if you start taking something expensive, hopefully you don't. Tell Mark I said hi. I retired from the military, currently 63 years old. I wanted to file for Social Security. How will this affect my military retirement? Well, thank you for your service. It won't affect it at all. That's a pension. Military retirement doesn't affect Social Security at all. Loretta, I'm 63 and I haven't worked in 2 years. I'm thinking about drawing my Social Security at 64. When I go to my Social Security account, it lists the amounts that I'll receive. Does the figure amount based on their assumption? Yes. So what it does is when you go into SSA.gov, which I recommend everybody go in there and set up an account, because if you set up an account, it makes it more difficult for someone else to go in there and pretend to be you and cause you headaches and aggravation. So set up an account like Loretta did there. Great, awesome. And she's planning for retirement, figuring out the numbers. Great. You're just knocking out of the park. But yes, it projects forward. So the closer you are to your full retirement age, the more accurate it is. So if you go in there at 55 and start looking at how much you're going to get at 67, it takes the last few years and it says, okay, it made $50,000 this last year and $50,000 basically the previous year. So we're going to project that this person is going to continue making $50,000 until their full retirement age. But if that changes, then those numbers are not accurate any longer. So in your particular case, it's only a couple of years and it's relatively recent, but if it's only those 2 years and you're going to go back to work, then it's more accurate. You can actually go in there and add those numbers yourself and kind of take out what the computer automatically puts in there. And yeah, or you can get even more accurate by calling the 800 number or visiting your local Social Security office and getting what's called a benefit matrix, and it'll tell you exactly how much your benefit would be a little bit more accurately. So. I owe back taxes and want to retire. Can the IRS take my Social Security check? The long arm of the law. Yes. Is your pension included as income when you start receiving Social Security benefits? No, generally, unless you're getting SSI, which is the welfare-based benefit, but you're talking just regular retirement or disability or survivor benefits or spouse benefits, then no. If you paid into Social Security through that work, if it's a non-covered pension, it does affect, but if you work for a governmental entity. Let me see. I am on SSDI being managed by Advantage Plan. Can I say goodbye to the Advantage Plan and use Medicare and supplements once I reach my full retirement age? Again, not your full retirement age, but 65. Once you hit 65, then yes, you can dump the Advantage Plan and get a Medicare supplement, and there's no underwriting, no denial for pre-existing conditions, but not FRA. That's your full retirement age. That's 66 or something. If you try to do it at that age, then they're going to deny you, or they can deny you. I owe Social Security $7,000 for working part-time, and I didn't realize the overtime and holiday pay. Yeah, so you worked over, and you told Social Security that you were going to stay under the annual earnings limit, but then you got some extra money, which is always a beautiful thing. So they're going to hold they're withholding $1 for every $2 you go over. So a couple of options you have is pay it off and just write a check for $7,000, which less than 1% of the people do that. I know, because I've done this a million times. But you can set up a payment plan and it's interest free. And now, thanks to Anderson Cooper, hey, Anderson Cooper, great job on 60 Minutes. They exposed the kind of the craziness of the overpayment system. And now you can do a 60-month, 5-year overpayment. It's really easy to do 60 months. So I would call Social Security and say, yeah. I know I went over, but I can't cut you a check for 7,000. Nobody expects you to cut you a check for 7,000. And you say, hey, set me up on a payment plan, and they'll take it out of your check, however much every month. So what if you never give middle name is wrong? What if you never give middle name? Yeah, same thing. Got to go down there and provide your original birth certificate and correct it. Super, super, super easy. Niece on SSDI alone, number of years, then back to work with better treatment for the condition, but now flaring again. Wants to keep one of her current jobs and resume SSDI. Must stay under $1,500. That is correct. 1,550 has to stay under that amount. So it sounds as though her SSDI, her Social Security Disability Insurance, possibly stopped because of work. She was able to go back to work because of her disability also got better. So if her benefits were stopped just because of work, and it's within the last 5 years, then she can file what's called an EXR, expedited reinstatement. They need to stop calling it expedited because nothing is expedited now in Social Security because they're so understaffed. But anyway, she can basically restart her benefits, and they can also give her 6 months of kind of pay while she's waiting for that decision to be made. So again, it has to be within 5 years, 60 months. Let's see. If I turn 66 in 8 months, August 2025, can I make more than 62,000 after 8/1, or can I only make 62 for all 25 without? It's before, so this the 62,000 is because once you hit your full retirement age, you can make $1 billion. So that 62,000 is only the months before your full retirement age, the year of your full retirement age. And then anything over that, they hold back $1 for every $3 you go over. So from 62 to the year before you turn your full retirement age, that's the $1 for every $2 you go over. And it's what, $24,000 next year. But the year you turn your full retirement age, any months before that, you're limited. And that's the limit. Is it worth it to try and work at 59 after being on SSDI for 14 years? It's so hard finding a sweet spot with work while trying to keep my benefits. Yeah. I did a video, couple of videos on working. Here are the videos. Let me take off this thing here. Oops. Take off that one so you can see it. Yeah. So I did a video. The top one is SSDI, Social Security Disability Insurance and working. There's trial work period and extended period of eligibility and ticket to work, and it's all crazy, but and that video explains it. And the bottom one is for SSI, the welfare-based benefit. So yeah, definitely check those out. But yeah, I mean, you probably make more money on, working than SSDI. So, and again, you can receive SSDI and work. You just have to stay within, the limitations. Currently 50 likes and of 150 watching. Come on, yeah, please, everybody like and subscribe and all that kind of good stuff. It helps the algorithm, and so people get out there and know that there's help out there. Too many people aren't receiving the benefits they're entitled to. All right, okay, yeah, same thing. Name's wrong on the website, so yes, you need to go down there. You'll probably need an SS5, which is the request for a replacement Social Security card, and you're not getting you are getting a replacement Social Security card because you're changing your name or you're updating your date of birth. Let's see. Have 2 minor children. My non-covered pension will trigger max WEP reduction, $558 for 2024. How will WEP affect family max benefit and my child's benefit? Yes. So your children's benefit is based on your primary insurance amount, your amount at your full retirement age. And if your primary insurance amount is $558, then they will get up to 50% of that. If there's more than 1 or 2 kids, then there's a family max, and the family max is also calculated based on your primary insurance amount. So I am 55, disabled on Social Security disability since 20s, divorced for last 5 years after being married just shy of 25. So once you hit, if that person is still alive and kicking, as soon as you hit 62, check to see if there's any more money on that record. A lot of people out there, here's another thing, a lot of people lose money. They're receiving disability benefits. And they don't want to go get survivor benefits that they might be eligible for because they think that will stop their disability, which is not a big deal because they get more money on survivor or spouse benefits. But the issue is Medicare. They're like, I don't want to stop my disability because then I'll lose my Medicare and I need my Medicare. No, you can get Medicare, or excuse me, you can get disability and get spouse benefits and divorce spouse benefits, independently entitled divorce spouse benefits and surviving spouse benefits, and continue to get disability and get Medicare, continue your Medicare because you are getting disability. And obviously there's, those spouse benefits, they're, what you're receiving disability offsets that and everything. So there's different calculations, but you can get all three of those. Again, one offsets the other in terms of money, but a lot of people are getting both, all three of those, but there are way too many people out there that are not getting those benefits because they don't know they can get it. So please fan out to everybody you know, friends, relatives, coworkers, and let's get money for people that need it. I have heard that OPM takes 9 months to a year to decide what amount of my ex-FERS pension will get. Also OPM hasn't cut my I hate to say, I avoid saying company names. Um, your health insurance. Okay. Yeah. When I took my early retirement from OPM, from Social Security Administration, it took, they gave me a kind of a tentative pension check, not very much. But hey, and then, then they recalculate it. Yeah. It takes forever. So there's that. And then it's almost impossible to get into the OPM and call them and talk to a human being and stuff. So yeah, almost bad as Social Security. Can I opt out of Medicare Part B if I have medical insurance through former employer, fully vested for working 36 years, 4 months, and have good medical insurance? Um, you can, but if you change your mind later, you're going to pay that penalty for every 10% for every 12 months. So if you have, again, because it doesn't sound like it's current work, you're talking about a retirement type plan. So that's not current work. So it's completely your decision. If you decide to, get out of Part B, but you have to check with that insurance company because sometimes they like that Part B because they're covering most of their costs. So you might cancel Part B and then go to the company and they say, no, we're not going to cover you because you don't have Part B. And then you've canceled it. So you can't re-sign up for it until January, February, or March. And then you get penalty. So I would definitely, consider all your options before you do anything. What do they even do at OPM? That's the Office of Personnel Managers, the federal government's HR, human resources. What about working after 62 and already collecting Social Security and will earn more than minimum? Then if you go over the annual earnings limit, then Social Security will withhold $1 for every $2 you go over. Victoria, thanks for answering my question. You are welcome. Thank you for asking the question. Switching from an Advantage plan to maybe G. Can one choose plan N? Yes, that's if you are able to make the switch from an Advantage plan to a G or an N or whatever the case may be, which a lot of people are trying to do, which and all those people that are being canceled, those millions of people that their plans are being canceled, oh my gosh, I'm being canceled. What do I do? Well, actually, you've got one really, really good thing is that because your plan is being canceled now at the bottom of the letter, if you read the letter, and again, there's a lot of people didn't read the letter, but at the bottom of those letters that says you're canceled, it says, because we're canceling your plan, you have the right to get a Medicare supplement without health underwriting, either a plan G or a plan F. So a lot of people out there are like, I hope I'm canceled. I hope I'm canceled. If they cancel me and before December 7th, I can switch to a Medicare supplement. But your question on whether you can, so you're in a Medicare supplement, you switched, and can you switch to an N next year? Yeah, you can do it. For a Medicare supplement plan, you can switch 365 days of the year. If you're in a G and want to switch to a cheaper G because they're all the same, it's only the price, and you want to switch to a cheaper G and save some money, and you have a special enrollment period or you're healthy or something, you can do that 365 days of the year. If you're in a G and want to switch to an N, same thing. If you're in an N, want to switch to a G, from an N to a cheaper N, whatever the case may be, you can do that 365 days of the year if you have a healthy pass underwriting, or if you have a special enrollment period. Reach out to, and some states you can do it regardless. California, New York, some other states have some special things. So reach out to chapter, and they'll be able to find out whether you can switch, and if so, they will find you some savings. If I am getting SSI and I will be 67 in a couple of weeks, I did obtain a part-time job. Okay, so if you're receiving SSI, that's the welfare-based benefit. So you're very, very limited to the amount of money you can make. So you're only receiving $943 for SSI, unless you're not receiving SSI. Then my answer is different. Why do I have to prove proof of taxes paid on a 403B pension? Yeah, that sounds like an IRS thing. And as regular viewers know, I have an issue with all these social media people out there that never worked at Social Security, never adjudicated a retirement or disability or survivor spouse claim in their entire life, but they're out there providing Social Security, information. And yeah, so there's so many people that are getting misinformation from social media, and that's why I never work for the IRS, and I don't provide IRS information because I stay in my lane. Kim, if deceased spouse owes taxes, does it affect the surviving spouse to claim deceased spouse benefit Social Security? Nope, not at all. No, I know that part because yeah, so that's the IRS might come after you if you're spouse or something. No telling what the IRS will do. But in terms of your Social Security benefit from your husband, that will not affect anything. Um, Once you get your check and IRS finds out you have a check and there's a debt and you were married or whatever, I don't know what the IRS is going to do. But in terms of Social Security, no. What happens if on SSI currently at age 60? What is the latest I can switch to Medicare? And how does my ex-husband's income figure into my Social Security? He's on a pension now. Okay. So SSI is the welfare-based program. So I'm thinking you don't mean SSI. You're thinking regular Social Security, perhaps, and I'm not sure what type. So if you're 60 years old, you're receiving survivor benefits or you're receiving disability. It's hard to answer this question. What is the latest I can switch to Medicare? If you're receiving survivor benefits, then 65 is when you can go on to Medicare. If you're receiving disability, then you got Medicare after being on disability for 24 months. Okay, all right, let's see here. Thank you for addressing my question. I can definitely make more working than on SSDI. I'd love to prove to myself that I can reacclimate to the work to full work, at least for yeah. And remember, anti-re, there is that trial work period because Social Security wants to, you make more money and you're happier if you get a job you like, and it helps the disability trust fund, and everybody benefits when you go back to work. So that's why Social Security set up this trial work period. So for 9 months, not necessarily consecutive, for 9 months, you can make all the money in the world and it doesn't matter anymore. So go out there, knock it out of the park for 9 months. And if it turns out that you can continue working, then make sure you notify Social Security and they'll essentially stop your benefits anytime, every month you go over the substantial gainful activity. And after that 9 months, you say, it's too hard on your body or whatever the case may be, then no harm, no foul. Hello, Blonde here again. Okay. I will be 67 in a couple of weeks. I will be starting a part-time job. Will my SSI be affected by either deduction or elimination of my SSI? Again, that's a welfare-based benefit. So I think you probably mean just regular Social Security. And no, because you're going to be your full retirement age. And I'm assuming you're not talking about SSI, you're talking about regular Social Security. So once you hit 67, you can make $1 billion a month. And if you make $1 billion a month, make sure you click on the link below and buy me a beer. I'm 55. I just applied for SSDI. The adjudicator calls, said she couldn't find my x-rays in medical records. I told her I would fax it over and give phone number of doctor to prove it. She said no. Yeah, I can't really fax medical record or x-rays. I don't think, yeah. Well, I guess, yeah. Um, w- um, yeah, the adjudicator at DDS, the Disability Determination Service. Um, so probably she'll have to. Sometimes the adjudicators don't like getting medical evidence directly from claimants, because guess what? Sometimes claimants plagiarize and mess up stuff and delete stuff and take out pages that are negative towards them and stuff. So sometimes adjudicators, they want to get it directly from the doctor or the hospital or something like that. So possibly that might be it. So she must be paranoid. She must have been once bitten, twice shy, right? Okay, IRS issue. Don't deal with the IRS. What happens if on SSI? Okay. All right. So SSI question again. Do the adjudicator deliberately try to sabotage you from getting SSDI? No. My seem to not want to help. I even told her I could fax over, mail anything you need. Again, yeah. So they've, they're probably going to request it directly from whatever medical facility. Mary, I am 43 years old. I was receiving child and care benefits since 2010. Hay cut my survivor's benefits when my daughter turned 16 and cut hers now. She's 18, but I got papers signed from school. Yeah, the child and care benefits stop when your child reaches 16. So that's correct. Unless your child has become disabled before the age of 22, and you have to go through that process to prove the disability. So yeah, that sounds right. Child and care benefits stop at 16, and the children's benefits stop automatically at 18. But yeah, you have to fill out the form. The school fills out the form. You send it in, and it sounds like they just haven't processed that paperwork yet. So once they process it, then the child's benefits will restart until they graduate. So make sure you watch out for that. Thank you for answering and explaining so I can make a wise decision. God bless you. Oh, thank you very much. I appreciate that. Divorced after 30 years, after age 60, remarried for 2 years, and working already collecting Social Security. Can I claim as independently entitled divorced spouse? Yes. Once you hit 62 years old and your ex-spouse is 62, then you can collect it independently entitled divorced spouse. But you're remarried for 2 years and working, okay. But if you're remarried to someone else, then no. Yes, it says that no underwriting. Okay, awesome. Yes, disqualify Penelope. Okay, yes, Penelope's jumping in and answering questions. She's always right, so I like it. I have to send this information to the Social Security office to determine. Okay, yep. Is chapter Medicare in today? Yeah, they're actually working, I think pretty much 7 days a week until December 7th. So yeah, give them a call. They're definitely working today. Yep, 7 days a week. I don't know. Are they going to take off Thanksgiving or something? I'm not sure. Can a CWIC help with where I would be in a trial work period? I've never understood how they roll it and how to make sense of when it starts. A CWIC. Oh, and you're an AWIC, an Area Work Incentives Coordinator. Yes. So you can reach out to Ticket to Work and they can explain it to you, or call the Social Security Administration, and the people that answer the phone, hopefully they give you a good explanation. But yes, an AWIC, absolutely. An Area Work Incentives Coordinator. So there's 9 regional areas of Social Security offices in the country, and within those there's districts, or there's areas and then districts. Within 1 or 2 or 3 or 4 or 5 offices in your area, there's one person that's designated to be the Work Incentives Coordinator, and you can go on to the Social Security website, the regional website. You just type in um, Atlanta or wherever you are, AWIC, and it'll give you the phone number and email for that particular AWIC, and they're supposed to be experts to help you out on all that kind of stuff. Next year, I am 64, retiring. Would affect me to collect a 401k and SSA plus pension. What is the maximum to collect? Maximum to collect on a 401k? $1 billion. Doesn't affect your Social Security at all. Again, your Medicare, you might get into the higher Medicare tax bracket. Um, let's see here. We are at an hour, so let me see anybody I haven't seen before. We'll get some new people questions. Hi, Dr. Ed. Is figuring out retirement a straightforward formula? I was on SSDI for about 7 years, so zeros in the calculation, I'm assuming. Went back to work for about 30 years after that. Yeah, it's basically your high 35 years of earnings, and they start with your AMI, it's called the averaged indexed monthly earnings. So they take your high 35 years of earnings and they index those earnings for essentially today's numbers, relatively today's numbers. $20,000 in 1970 is worth not $20,000 today. So they index it. And then they take that average monthly and multiply it by what's called these bin points, 90%, 32%, 15%. There's certain number of factors, amounts there. And then they come up with your replacement, your benefit amount. And it's usually, 44, 45, 46% of your average benefit amount. So is it relatively straightforward? Yes. Is it long division? Yeah. Hear my cat in the background. Sorry. What date my SSDI benefits start if found disabled on 12/21 and didn't file? It really depends whether they can go back, because there's several dates. There's the AOD, the alleged onset date, which you gave them. There's the POD, the potential onset date and then there's the EOD, the established onset date. So that's the established one of when they determine. And if they found you disabled, sometimes they can only go back 1 year, but there's many exceptions to the exceptions to the exception. All right. So unfortunately, we are over. We're an hour, and we'll cut it here today. I will be back again tomorrow.